Hackney. I run the diabetes group for Medtronic. I have a question about patient engagement, and you had touched on this before. All of these advances are amazing, but even if you make the greatest drug or the greatest wearable, there's no guarantee that the patient is going to take the drug, wear the device. So how are you thinking about technology to engage the patient?
Again, maybe I will use an example. I think it's fascinating what's happening in this field right now. I mean, FDA approved the first electronic pill, if I can call it like that. So it is basically biological chip that it is in the tablet. And once you take the tablet and dissolves into your stomach, sends a signal that you took the tablet. So imagine the applications of that, compliance. The insurance companies to know that the medicines that patients should take, they do take them. It is fascinating what happens in this field. But of course, there will be an initial cost that someone needs to invest.
Of course, education, skills, but my sense is that we will move increasingly. Today we have hospital-centric or doctor-centric care, and the question is, will we move to a patient-centric care where the patient starts to pull if you're going to move particularly to a preventive healthcare world. And I guess we don't see that level of patient engagement today because the awareness is massive, because many of these devices, they're not continuous monitoring and they're not medical grade today, the wearable devices I'm talking about. So the in vivo devices are more fitness-based devices as opposed to real medical grade, making a difference. So if you have to stop pricking yourself and start to have a non-invasive technique to understand your glucose level or not to go to a blood test and understand your cholesterol levels, then obviously people will go more for that option because it's just non-invasive to begin with, and it is continuous. So there's education, there's skills, but also you need the right kind of devices and infrastructure to be in place.
Michael, with your physical comment earlier, you seem to emphasize that we're still going to need the human. To his point about people just using it, you'll need the human interaction with the technology, not just the technology,
Very
right?
true. And we've done a little research, not enough that I would consider it peer-reviewed level. But it says a lot of individuals who do not take their drugs, it's often because of a side effect. And that's where the physician, the nurse practitioners, others have to interface with the patient and help them understand the value and the benefit of it versus the other issues. So we've seen that, and then we have to have a way to overcome it. And I think it's, once again, that personal intervention sometimes is needed that AI just won't do.
Yeah, we believe also in a human-augmented AI type of system because, yes, you have AI, but you will need that human intervention.
It's a combination of computers and people work best, not just.
Exactly, right.
I saw another question right here.